1. A nurse on a medical surgical unit is prioritizing care for 4 clients. Which hypertensive client should the nurse assess first? 1. A client with BP 148/92 mmHg, complaining of a mild headache. 2. A client with BP 190/116 mmHg, who is confused and restless. 3. A client with BP 156/98 mmHg, awaiting discharge instructions. 4. A client with BP 160/100 mmHg scheduled for a diagnostic test. Answer. The nurse should assess the client with BP 190/116 mmHg who is confused and restless. Rationale. Confusion and restlessness with severely elevated blood pressure may indicate hypertensive encephalopathy or impending stroke, requiring immediate attention. 2. A nurse is caring for a client with newly diagnosed hypertension. Which task can be delegated to the unlicensed assistive personnel UAP? 1. Educating the client about sodium restriction. 2. Monitoring blood pressure every 4 hours. 3. Assessing for side effects of antihypertensive medication. 4. Adjusting the client's medication dose. Answer. Monitoring blood pressure every 4 hours can be delegated to the UAP. Rationale. UAPs can measure and report vital signs, but client education, assessment, and medication management must be done by licensed nurses. 3. A nurse is planning discharge teaching for a client with hypertension. Which instruction is most appropriate to promote long-term blood pressure control? 1. Take medication only when symptoms appear. 2. Follow a high-protein diet. 3. Limit alcohol intake and avoid smoking. 4. Increase fluid intake to 3 liters per day. Answer. Limit alcohol intake and avoid smoking. Rationale. Lifestyle modifications including limiting alcohol, avoiding smoking, reducing sodium, and regular exercise are essential for long-term blood pressure control. 4. A nurse receives a client from the emergency department with a blood pressure of 220/118 mmHg. Which intervention should the nurse implement first? 1. Call the rapid response team. 2. Administer 4 antihypertensive medication as prescribed. 3. Notify the healthcare provider. 4. Elevate the client's legs and monitor for dizziness. Answer. Administer 4 antihypertensive medication as prescribed. Rationale. In hypertensive emergencies, rapid but controlled lowering of blood pressure with 4 medications is the first-line intervention to prevent end-organ damage. 5. A nurse is evaluating the effectiveness of antihypertensive therapy. Which finding indicates a need to reassess the plan of care? 1. Blood pressure consistently at 138/88 mmHg. 2. Client reports no side effects. 3. Client gained 5 pounds in 3 days. 4. Client is walking 30 minutes daily. Answer. Client gained 5 pounds in 3 days. Rationale. Rapid weight gain can indicate fluid retention or heart failure, a potential complication of uncontrolled hypertension. 6. A client with hypertension is prescribed a beta blocker. What should the nurse teach the client to report immediately? 1. Mild fatigue. 2. Occasional dizziness on standing. 3. Wheezing and shortness of breath. 4. Decreased libido. Answer. Wheezing and shortness of breath. Rationale. Beta blockers can cause bronchospasm, particularly in clients with a history of asthma or COPD, and these symptoms require immediate medical attention. 7. A nurse is assigning care for a group of clients. Which hypertensive client is appropriate to assign to a licensed practical nurse LPN? 1. A client admitted with hypertensive crisis needing for medication. 2. A newly diagnosed client needing detailed medication teaching. 3. A stable client receiving oral antihypertensives. 4. A post-stroke client requiring swallowing evaluation. Answer. A stable client receiving oral antihypertensives. Rationale. LPNs can care for stable clients and administer oral medications, but cannot handle unstable conditions or conduct initial teaching or evaluations. 8. A nurse is caring for a client with hypertension who refuses to take prescribed medications due to concerns about side effects. What is the nurse's best initial action? 1. Educate the client on consequences of untreated hypertension. 2. Notify the healthcare provider to change the prescription. 3. Document the refusal and continue with other care. 4. Ask the client to describe specific concerns about the medication. Answer: ask the client to describe specific concerns about the medication. Rationale: understanding the client's perspective allows the nurse to address concerns, promote adherence, and advocate for possible changes with the healthcare provider. 9. A hypertensive client on a diuretic reports muscle cramps and weakness. What should the nurse do first? 1. Encourage fluid intake. 2. Check the most recent electrolyte levels. 3. Notify the healthcare provider. 4. Administer potassium as prescribed. Answer: check the most recent electrolyte levels. Rationale: diuretics, especially loop and thiazide diuretics, can cause hypokalemia, leading to cramps and weakness. Verifying lab values guides safe intervention. 10. A nurse is reinforcing dietary teaching with a hypertensive client. Which client statement indicates the need for further teaching? 1. I will avoid canned soups and processed meats. 2. I'll use salt substitutes made with potassium. 3. I will check nutrition labels for sodium content. 4. I will limit eating out to reduce salt intake. Answer: I'll use salt substitutes made with potassium. Rationale: some salt substitutes contain potassium, which can be dangerous for clients on ACE inhibitors or potassium-sparing diuretics. 11. A nurse is caring for a hypertensive client scheduled for a CT scan with 4 contrast. The client is taking metformin. What is the priority nursing action? 1. Instruct the client to drink fluids after the scan. 2. Hold the metformin before the scan. 3. Monitor blood glucose after the scan. 4. Give the metformin with food after the scan. Answer: hold the metformin before the scan. Rationale: metformin should be withheld before contrast exposure to reduce the risk of lactic acidosis if contrast-induced nephropathy occurs. 12. A client with hypertension is receiving lisinopril. Which finding requires immediate nursing intervention? 1. Blood pressure of 130/84 mmHg. 2. Heart rate of 72 bpm. 3. Serum potassium of 6.0 milliequivalent/L. 4. Dry cough for 1 week. Answer: serum potassium of 6.0 milliequivalent/L. Rationale: ACE inhibitors can increase serum potassium, and hyperkalemia can be life-threatening, requiring urgent intervention. 13. During a community health screening, a client has a BP of 182/110 mmHg, but denies any symptoms. What should the nurse do next? 1. Document and tell the client to follow up at the next visit. 2. Instruct the client to go to the emergency department. 3. Educate about lifestyle changes and check again next month. 4. Advise the client to see a healthcare provider as soon as possible. Answer: advise the client to see a healthcare provider as soon as possible. Rationale: asymptomatic severe hypertension, hypertensive urgency, still requires prompt evaluation and possible initiation of antihypertensive therapy. 14. A nurse is evaluating understanding after teaching a hypertensive client about home blood pressure monitoring. Which statement indicates correct understanding? 1. I should check my blood pressure right after smoking. 2. I'll measure my blood pressure at the same time each day. 3. I should lie down while taking my pressure. 4. I'll record only high readings in my journal. Answer: I'll measure my blood pressure at the same time each day. Rationale: consistent timing helps ensure accurate trends and reduces variability due to normal daily fluctuations. 15. A nurse is caring for a client with uncontrolled hypertension and new onset blurred vision. What is the priority nursing action? 1. Notify the healthcare provider. 2. Lower the lights in the room. 3. Ask about headache severity. 4. Assess blood glucose level. Answer: notify the healthcare provider. Rationale: blurred vision may indicate hypertensive retinopathy or stroke. Immediate evaluation is necessary to prevent further complications. 16. A nurse is teaching a hypertensive client about the DASH diet. Which food should the nurse encourage? 1. Canned vegetables. 2. Fried chicken. 3. Baked salmon. 4. Pickled cucumbers. Answer: baked salmon. Rationale: the DASH diet emphasizes lean protein, fruits, vegetables, and low-sodium options like baked salmon. 17. A client with a history of hypertension develops a severe nosebleed and BP of 198/114 mmHg. What is the nurse's first action? 1. Call ENT specialist. 2. Sit the client upright and apply pressure. 3. Start 4 fluids. 4. Recheck BP in 30 minutes. Answer: sit the client upright and apply pressure. Rationale: nosebleeds in hypertensive clients may signal vascular rupture. Positioning and pressure are immediate interventions before further evaluation. 18. A hypertensive client on hydrochlorothiazide reports feeling dizzy when standing. What is the most appropriate initial nursing action? 1. Encourage the client to drink more water. 2. Review the client's morning blood pressure reading. 3. Instruct the client to lie flat. 4. Notify the healthcare provider. Answer: review the client's morning blood pressure reading. Rationale: orthostatic hypotension is a side effect of diuretics. Reviewing BP helps determine the need for intervention or medication adjustment. 19. A nurse is caring for a pregnant client diagnosed with gestational hypertension. What finding requires immediate intervention? 1. BP 142/88 mmHg. 2. Mild pedal edema. 3. Urine protein 2+. 4. Complaint of occasional fatigue. Answer: urine protein 2+. Rationale: proteinuria in a hypertensive pregnant client may indicate progression to preeclampsia, requiring prompt evaluation. 20. A hypertensive client reports stopping their medication because "I feel fine now." What is the most appropriate nurse response? 1. Let's call your provider and change your medication. 2. You must continue the medication even if you feel well. 3. Missing a few doses won't cause serious problems. 4. Next time, try lowering the dose instead. Answer: you must continue the medication even if you feel well. Rationale: hypertension is often asymptomatic, and stopping medication can result in dangerous complications like stroke or heart attack. 21. A nurse is reviewing the medication list of a hypertensive client and notices that the client is also taking NSAIDs for arthritis. What is the most appropriate nursing intervention? 1. Advise the client to double the dose of antihypertensive medication. 2. Inform the client that NSAIDs are safe with blood pressure medications. 3. Notify the healthcare provider about the use of NSAIDs. 4. Recommend taking NSAIDs only at bedtime. Answer: notify the healthcare provider about the use of NSAIDs. Rationale: NSAIDs can increase blood pressure and reduce the effectiveness of antihypertensive medications, so the provider should evaluate continued use. 22. A nurse is monitoring a client with hypertension who is receiving nifedipine. Which symptom requires immediate attention? 1. Mild ankle swelling. 2. Bradycardia. 3. Facial flushing. 4. Chest pain. Answer: chest pain. Rationale: chest pain may indicate angina or myocardial infarction, which can be a serious side effect of rapid vasodilation from calcium channel blockers like nifedipine. 23. A hypertensive client reports persistent dry cough after starting captopril. What is the most appropriate nursing action? 1. Suggest using a cough suppressant. 2. Encourage the client to drink warm fluids. 3. Document the symptom and reassure the client. 4. Notify the healthcare provider for possible medication change. Answer: notify the healthcare provider for possible medication change. Rationale: ACE inhibitors like captopril often cause a dry cough. Switching to an ARB may be necessary. 24. A nurse is preparing to administer morning medications to a hypertensive client. The blood pressure is 90/58 mmHg. What should the nurse do first? 1. Administer the medication with extra fluids. 2. Hold the medication and notify the provider. 3. Elevate the client's legs and give the medication. 4. Ask the client if they feel dizzy. Answer: hold the medication and notify the provider. Rationale: administering antihypertensive medication with low blood pressure could worsen hypotension and compromise perfusion. 25. A nurse is providing education to a client with hypertension who is being discharged on clonidine. Which instruction is most important to include? 1. Avoid eating grapefruit while on this medication. 2. Do not stop the medication abruptly. 3. Take the medication only when feeling anxious. 4. Increase dietary fiber to prevent constipation. Answer: do not stop the medication abruptly. Rationale: abrupt withdrawal of clonidine can cause rebound hypertension, which can be severe and life-threatening. 26. A client with hypertension is placed on telemetry. The nurse notices frequent PVCs and reviews the lab results, showing a potassium of 3.1 milliequivalent/L. What is the nurse's next best action? 1. Encourage potassium-rich foods. 2. Notify the healthcare provider. 3. Monitor for muscle cramps. 4. Continue to observe the rhythm. Answer: notify the healthcare provider. Rationale: hypokalemia can cause arrhythmias, such as PVCs, and must be promptly corrected to prevent cardiac complications. 27. A nurse is assessing a hypertensive client for complications. Which finding suggests end organ damage from hypertension? 1. Fatigue and insomnia. 2. Bounding peripheral pulses. 3. Retinal hemorrhages. 4. Slight weight gain. Answer: retinal hemorrhages. Rationale: retinal changes can indicate chronic hypertension-related damage and are signs of target organ involvement. 28. A nurse is planning care for a hypertensive client who is obese and sedentary. What is the most appropriate goal to include in the care plan? 1. Client will lose 10 pounds in 2 days. 2. Client will walk 30 minutes, 5 days per week. 3. Client will avoid all carbohydrates. 4. Client will stop taking antihypertensive medication. Answer: client will walk 30 minutes, 5 days per week. Rationale: regular aerobic exercise is an effective non-pharmacologic strategy to lower blood pressure and promote cardiovascular health. 29. A nurse is educating a client newly prescribed spironolactone. What should the nurse emphasize in the teaching? 1. Increase intake of bananas and oranges. 2. Report symptoms of breast tenderness. 3. Expect frequent urination at night. 4. Use salt substitutes liberally. Answer: report symptoms of breast tenderness. Rationale: spironolactone is a potassium-sparing diuretic with anti-androgen effects, and gynecomastia or breast tenderness may occur. 30. A nurse receives handoff report on a hypertensive client with BP 168/100 mmHg and reports chest pressure. What is the priority action? 1. Recheck BP in 30 minutes. 2. Call a code blue. 3. Administer prescribed pain medication. 4. Obtain a stat ECG. Answer: obtain a stat ECG. Rationale: chest pressure in a hypertensive client could indicate myocardial ischemia, and an ECG is essential for immediate assessment. 31. A nurse is caring for a client taking losartan. Which assessment finding requires further evaluation? 1. BP of 138/86 mmHg. 2. Pulse 68 BPM. 3. Serum potassium 5.8 milliequivalent/L. 4. Client reports occasional nausea. Answer: serum potassium 5.8 milliequivalent/L. Rationale: ARBs like losartan can cause hyperkalemia, and a potassium level above 5.5 requires intervention to prevent cardiac effects. 32. A hypertensive client expresses reluctance to start medication therapy. What is the nurse's best initial response? 1. You have no choice, it's necessary. 2. What concerns do you have about the medication? 3. You can try natural supplements instead. 4. Just start the medicine and see how it goes. Answer. What concerns do you have about the medication? Rationale. Open-ended questions help identify barriers to adherence and allow the nurse to address misconceptions or fears. 33. A nurse is caring for a client with a history of uncontrolled hypertension, now presenting with severe headache and vomiting. What is the nurse's priority? 1. Dim the room and let the client rest. 2. Check blood glucose level. 3. Assess neurological status. 4. Offer antiemetic medication. Answer. Assess neurological status. Rationale. Headache and vomiting may indicate increased intracranial pressure or stroke. A focused neurological assessment is critical. 34. A hypertensive client is started on hydralazine 4 for a hypertensive crisis. What parameter should the nurse monitor most closely? 1. Liver enzymes. 2. Urine output. 3. Blood pressure. 4. Peripheral pulses. Answer. Blood pressure. Rationale. 4-hydralazine causes rapid vasodilation. Frequent BP monitoring is required to prevent hypotension or rebound hypertension. 35. A nurse is planning to delegate vital sign collection for a hypertensive client on 4-labetalol. What instruction should the nurse provide to the UAP? 1. Report any temperature over 100.4 degrees Fahrenheit. 2. Notify the nurse if the systolic BP drops below 100 millimeters of mercury. 3. Reposition the client every 2 hours. 4. Offer fluids after BP is measured. Answer. Notify the nurse if the systolic BP drops below 100 millimeters of mercury. Rationale. For labetalol can cause hypotension. The nurse should instruct the UAP to report low BP readings for prompt intervention. 36. A nurse is assessing a client with long-standing hypertension. Which assessment finding indicates possible heart failure? 1. Warm extremities. 2. Bilateral crackles in the lungs. 3. Capillary refill less than 2 seconds. 4. Clear breath sounds. Answer. Bilateral crackles in the lungs. Rationale. Crackles may indicate pulmonary congestion from left-sided heart failure, a common complication of chronic hypertension. 37. A hypertensive client reports frequent missed doses of medication due to cost. What is the nurse's best action? 1. Advise the client to take half doses to save money. 2. Refer the client to a social worker or case manager. 3. Instruct the client to stop eating out. 4. Tell the client to ask family members for financial help. Answer. Refer the client to a social worker or case manager. Rationale. A case manager can help the client access affordable medication options or insurance programs to support adherence. 38. A nurse is reinforcing teaching for a client prescribed enalapril. Which client statement indicates a need for further education? 1. I will rise slowly to avoid dizziness. 2. I should report a persistent dry cough. 3. I can take this medication during pregnancy. 4. I will have my potassium checked regularly. Answer. I can take this medication during pregnancy. Rationale. ACE inhibitors are contraindicated during pregnancy due to risk of fetal harm. 39. A hypertensive client taking multiple medications says, I keep forgetting to take my pills. What should the nurse suggest first? 1. Use a daily pill organizer. 2. Set a reminder on a phone or clock. 3. Ask a family member to remind them. 4. Visit the clinic daily for observed dosing. Answer. Use a daily pill organizer. Rationale. A pill organizer is a simple, cost-effective method to improve adherence and ensure doses are not missed. 40. A nurse is evaluating the outcome of care for a hypertensive client. Which finding indicates successful management? 1. BP consistently at 150/98 mmHg. 2. Client reports taking medications every other day. 3. BP consistently under 130/80 mmHg. 4. Client requires weekly emergency BP checks. Answer: BP consistently under 130/80 mmHg. Rationale: this value is within target goals for most adults with hypertension, indicating effective management. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!